Hello, thanks again for joining us. Thanks for tuning in to another one of our video presentations. This one on preparing for pregnancy part 2. We just completed part 1. You may have already viewed that. This is part 2. This is Joe DiMatteo of the Len and Joe Ask the Pharmacist group. Len and I are both pharmacists, board certified in clinical nutrition, and doctors of naturopathy medicine. I want to thank you for tuning in and thanks for being with us here today. I think it's very, very important that a woman understands the role of pre-gestational issues prior to pregnancy. What can I do to improve the potential for conception? What can I do to attempt to support and support myself through gestation, carrying that child? And then lastly, how do I ensure some of the benefits for my child, for my offspring? What can I do? There are certain factors that we can't control, but there are factors that we can. We want to discuss factors that you can. In the previous video session, we talked about preparing for pregnancy. We talked about the role of trans fatty acids being a huge problem for ovulatory infertility or ovulatory failure. Bad fats, deep fried fats, hydrogenated fats are huge. You substitute them for good fats, olive oils, omega-3 fish oils, nuts and seeds, the fats from nuts and seeds. You are absolutely increasing your risk for ovulatory infertility. That's from an article from Medscape back in 2007. The other area we talked about not gaining weight. It's important that you lose weight or you're more at an ideal body weight. Why? It plays a huge role. It is very, and not conceiving, it is very closely linked to rising levels of insulin, what we would term as naturopaths insulin resistance. Notice we're not talking about blood sugar here, we're talking about insulin. If I'm insulin resistant, that means I'm punching out entirely too much insulin, even on a fasting state. What that does is antagonizes the ovaries of a woman, causes her estrogen levels to rise, her testosterone levels to rise, and her progesterone to drop. Can lead to infertility, lead to ovulatory failure, disrupted cycles. The potential to conceive becomes a huge problem. And then even once you have conceived, the potential to gain weight during pregnancy, a huge issue. Brief review, vitamin D, the importance of vitamin D. It's just as important prior to conception as it is to when you're gestating, carrying the baby. D3 levels can absolutely impact the health of your offspring. More and more literature showing that the overall health rates of type 1 diabetes, bone health in the offspring, in your infant, are directly tied and related to your vitamin D levels during gestation and even prior to gestation. You must have a 25 OHD level done. We left off with gastrointestinal health. We shouldn't look at it, I'm pregnant today, or I'm desiring to become pregnant, so now today I will get concerned about my weight and my vitamin D levels and the levels of omega-3s. No. We should be preparing for this by managing our weight, understanding the role of fats, understanding the role of antioxidants in my system. We mentioned in the previous teaching that quality antioxidants, buffered C ascorbates, mixed tocopherol, tocotrienol blends of perfect E, vitamin E, adequate levels of magnesium, adequate levels of a mixed multivitamin with quality minerals on board, even zinc, are critical to helping a woman be adequately prepared for conception. Why? We're finding more and more environmental influences that can affect not only your spouse and the ability to produce sperm, but the quality of the sperm. We know that probably in the last 30 years that sperm counts in general in the U.S. population are down approximately 30%. We also know that there's more and more difficulties with quality, morphology of sperm as well. So that's on the male side. But there are literature pieces that are showing even in women that are undergoing fertility treatments, you load them up with quality antioxidants, their rate of conception goes up. Why? Many of the chemicals we're exposed to, the compounds, plasticizers, chemicals, bisphenol A's, the list goes on, that can affect the potential for conception. We're talking about cell with cell. And chemicals and compounds that our body's not adequately removing can affect this cell-cell interaction in a huge way. We also know that non-steroidal drugs can affect the potential for conception and also maintaining an infant during gestation or pregnancy. Non-steroidals are anti-inflammatory drugs, ibuprofens, naproxens, Aleve, Advils, Nuprins, meloxicams, the list goes on, used for pain, for inflammation. Many times they're used for menstrual type pain, for headaches, migraines, plays a key role. You need to be aware of it. Also, how basic nutrients must be on board. You have to have adequate levels of folate. Everybody knows that, to reduce the rates of spina bifida. But the literature is even stronger to understand that even having adequate levels of B12, not just folate, B6, other multi-nutrients, and the Bs in general to lower homocysteine. Homocysteine is associated with problems with miscarriages. And I know this is pre-pregnancy, but you need to understand you don't just turn this off. It's not like flicking on a switch. We must be prepared as we attempt to conceive. If there are problems with fertility, there's more and more literature that associates a gluten intolerance, wheat intolerance, celiac disease, increasing the rates of infertility. I would recommend that a woman consume only non-genetically modified sources of wheat wherever possible, or organic sources of wheat whenever and wherever possible. We know that recent literature showing that adding DHEA to a woman's in vitro fertilization procedures can improve her rate of fertilization. Talking again about hormones and how hormones affect the ability to conceive. So your weight, we must be at a reasonable weight, as reasonable to a lowered body mass index as possible. I recommend that you be in as good a physical condition, skeletal muscle, body tone as well. The role of having plenty of omega-3 fatty acids, high in DHA. We have personally made for us and manufactured omega-3 800s, very high in DHA. One capsule has almost 300 milligrams of DHA per capsule. Very important for neural development in the child. So again, this is not just, well, now I'm pregnant, I'm 7 weeks pregnant, and now I should start doing something. You should have a solid run-up to this. So we've covered some basic areas. We haven't really talked a ton about the diet, but your diet is critical in all of this. You've got to have preferably organic vegetables and fruit wherever you can. Preferably, if it's not local farm-raised and farm-grown types of fruits and vegetables, wash them well. Wash them in a cup of apple cider vinegar to a gallon of water. Let your vegetables soak for up to 25 to 30 minutes to remove some of the residual types of pesticides and so on that are sprayed. Understand the key role of predominantly grass-fed beef, organic eggs, free-range or organic chicken, for example, as poultry. Understand the role. Watch your weight. Have plenty of nutrients on board. Eat plenty of things like raw nuts and seeds, quality fats, rich in minerals, rich in micronutrients as well. Good bacteria plays a key role in helping to reduce potential complications in your offspring later on during this series. The better the good bacteria, the healthier your offspring is, especially from an allergen standpoint. Two segments that we've done, part 1, part 2 on preparing for pregnancy. Hopefully you've learned something. Soon to follow, pregnancy, gestation. What are some of the things? There'll be some truth and some parallel between the two, but there will be some more specific components that we'll talk about. So stay tuned for further teachings and videos to come. Thanks for tuning in, and God bless.